My name is Lysandra Swayze, student of Durham College. This is my ID, and I have my client here with me, Marion. I'm now gonna ask her consent to be in this video. Do you give consent to be in this video, Marion?
Yes, miss.
Okay, consent given. I would do my hand hygiene before entering the client's room. Now that I'm in my client's room, I would introduce myself to my client. My name is Lysandra and I'm a student nurse of Durham College, and I'll be doing a head to toe assessment today. I would then do my environmental checks, such as ensuring that no clutter, cowbell was within reach, the bed was in its lowest position, oral airway working, free from clutter, and her oxygen is also working, suction is working. Now that I've done that, I'm gonna now check my client's wristband, ensuring it's a right client that I'll be doing, and I'm now gonna ask her a few questions. I could see she's alert and awake. Her skin color is consistent throughout, which matches her ethnic background. Do you know what day is today?
Yes.
You know where you are?
Yes.
Client is oriented, time 3. And now, before I do that, I'm just gonna ask her a few more questions. What bring you here today?
Headache.
Okay, can you describe the pain?
This is a pounding pain across my forehead.
Okay, can you point or tell me exactly what region you feel the pain?
Across here.
Okay, and you describe it. Can you describe the pain?
It's pounding. It's maybe 8 out of 10.
Okay, on a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain you've ever felt, how bad is your pain?
Maybe 8.
Okay, do you know what time of day your pain normally occurs?
Midday. Because of I have a light sensitivity.
Has this ever happened to you before?
Yes.
Okay. Earlier, I checked my client's vital signs. Her temperature was 37, which is within a normal range of 36 to 37 degrees Celsius. I also did her pulse, which was normal. It is within the normal range of 60 to 100, and I got 64. I did her respirations, I got 16. It's within the normal range of 12 to 20 breaths per minute. Her BP, I got 112/80, within the normal range of a low end of 90/50 and a high end of 140/90. I also did her O2 and I got 96, within the normal range of 95 to 100. Now I'm going to start by looking at her eyes, at her pupils. When I shine this light in your eyes, I want you to look over my shoulder as I'm going to be shining the light. Her pupils constrict. They are rounded and equal bilaterally. I want you to look over my shoulder as I bring this pen close. Her pupils are rounded. When I brought the pen away from her, her pupils relaxed. They are rounded and equal bilaterally. I am now going to assess her arms. I can see she has no signs of cyanosis, no pallor, and her skin color matches her ethnic background. I am going to palpate. She has no signs of edema, no rashes, no hives. Now I'm going to check her brachial pulse. Her pulse they are strong and equal bilaterally. Her radial pulse is also strong, equal bilaterally. I want you to grasp my fingers and squeeze them together. Her muscle strength is strong, equal bilaterally. Her cap refill, I'm gonna put on your nails. They blanches back and return to its normal color within 3 seconds, which means it's normal. I am now going to look at her chest. Okay. She has no difficulty breathing. She's not using any accessory muscles to breathe. Her skin color matches her ethnic background. No hives. I'm gonna assess for any lumps. She has no lumps or mass. Her skin is warm and dry. Now that I've done that, I'm just gonna ask my client if she could just sit up in bed as I listen to her lung sound. I want you to take deep breath as I. So her airway is clear. She is breathing fine, and I could see that her ribs are sloped down and her costal angle is less than 90 degrees. Is there any tenderness?
No.
Okay, if there was any tenderness, I would palpate or assess that area last. Now that my client is sitting upright in bed, I am now going to listen to her heart. Okay, starting at the aortic valve, right of the sternum border, second intercostal space, her S2 is louder than her S1, moving to her pulmonic valve, left of the sternum border, second intercostal space, her S2 is louder than her S1, down to her Erb's point, third intercostal space, her S1 is equal to her S2, moving down to her tricuspid valve, fourth and fifth intercostal space, her S1 is louder than her S2, mitral valve, fifth intercostal space, left of her sternum border, her S1 is louder than her S2. I am now going to ask my client if she could lay back in bed. As she lays back in bed, I'm just going to ask her a few questions. Have you have any change in your appetite lately?
No.
No change in. When was your last BM? When was your last bowel movement?
This morning.
Sorry. Okay, so she has no change in appetite. I'm now going to ask my client if it's okay for me to lift up her shirt. Is it okay for me to lift your shirt?
Yes, ma'am.
Consent given. Okay. At this time, I would be checking for any colostomy bag, any dressings. She has no scars. Her skin color is even and consistent, matches her ethnic background. At this time, I would also check her contour. Client's belly is rounded. I am now going to listen to her bowel sounds. I will start from the right lower quadrant, the right lower quadrant, moving my way up to the right upper quadrant, left upper quadrant, left lower quadrant. Her bowel sounds are present. I'm now gonna use my fingertips 1 centimeter just to palpate right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I assess she had. Do you have any tenderness?
No.
Client has no tenderness. If she did, I would have done that area last. She has no dressing, no hives, no lumps or masses. I'm now gonna move down to doing her lower extremities. I can see her hair is evenly distributed. Her skin color matches her ethnicity. She has no signs of cyanosis, no pallor. Tell me if you have any tenderness. Any tenderness? No tenderness. Skin is warm and dry. I'm going to palpate a little bit. No signs of edema. I'm now going to check her strength. Do you mind pushing your legs up? Her strengths are even bilaterally, which is normal. Checking her cap refill. Her pediastasis pubis. They are both strong and equal bilaterally. Her toenail blenches back within 3 seconds, which is normal. I'm now gonna ask my client to sit upright so I can listen to her posterior chest laterally. Is it okay if you sit at the end of the bed for me, please, turning your back to my camera? Okay, I'm just gonna pull. Is it okay if I pull your shirt down? I could see her back. Her color is consistent. No signs of cyanosis or pallor. It is symmetrical. I am now, if there's any tenderness, let me know. Any tenderness? Okay. I want you to take deep breath as I move the stethoscope. Okay, so my client has no adventitious sounds. Her airway sounds clear. She has no sign of cyanosis, no lumps, no tenderness, no masses. You could turn around. Now that I've done that, I will now pass these information on to the doctor. I will also inform him of your headache. Is there any questions you have for me or anything else you'd like me to do for you before I leave? Okay, thank you.
Okay.